Hi, I'm Rachel Legg. I'm a real estate agent in the Wesley Chapel, New Tampa area. I noticed that my hip was kind of bothering me and it was hard to, I would have like a kind of a limp and then it kind of got worse and worse.
When I first saw Rachel in my office, she had been complaining of hip pain for roughly a year. She'd undergone physical therapy and had been taking anti-inflammatories with minimal relief.
I was done not being able to do my job. As a real estate agent, I had to walk places. I couldn't do that anymore. And I was just like, all right, I'm done. I got to do something.
So we had discussed treatment options, which included a hip replacement in her case. There's a number of different ways to do hip replacements. Traditionally, patients had hip replacements from a posterior approach, but for her case, we elected to go with an anterior hip replacement.
And I really liked his background because he had a long list of stuff. He had done the extra fellowship work at Johns Hopkins, and he had more training, it seemed like, and experience in the anterior hip replacement.
With an anterior hip replacement, the incision is in the front of the hip. We go between the muscles rather than through them. This allows for less pain postoperatively, a quicker recovery, smaller incision, and a shorter hospital stay.
Before, I couldn't walk without limping. Now I have no limp. I can go on trips. I'm just very grateful to Dr. Auld and the entire team at the hospital at Advent Health who were part of the whole process, because prior to the surgery, I felt 20 years older, and now I feel 20 years younger.